All right. Good morning, everyone. Happy New Year and welcome to a new year and a new edition of FWMD Live. Today, we will be talking with Tarrant County officials and experts to address and answer any questions you may have regarding COVID-19 vaccinations. We will also be talking about keeping college campuses safe as the COVID-19 pandemic continues into 2021. And specifically, we're going to talk about how Texas Christian University has approached this Herculean task and continues to address safety during the pandemic. But before we get to all of that, let's start with me. I'm your host. I'm Prescott Stokes III, the Integrated Content and Marketing Manager here at the TCU and UNT HSC School of Medicine. And today, joining me as a co-host for our discussion for the second time is Dr. Stuart Flynn, the Dean of our School of Medicine, who in addition to being the Dean of our School of Medicine is also a surgical and molecular pathologist by training. Welcome, Dean Flynn.
Thank you, Prescott. Thank you, panelists, and welcome, everybody.
All right. And so we are also excited to have another esteemed guest with us this morning. We have TCU's Chancellor Victor J. Boschini Jr. joining us. How you doing, Chancellor Boschini?
Good. Happy New Year. Thanks for having me.
All right. That's great. And now also joining us for our chat is Professor Kiri Akaraju.
Hi, Prescott. Nice to be here. Thanks for inviting me.
All right, great to have you, Professor Akaraju. Now, I just want to say that Professor Akaraju has a PhD in molecular genetics and biochemistry and is a professor and department chair at TCU's College of Science and Engineering. And viruses, like COVID-19, happen to be one of his areas of expertise. And he is also a professor here at the School of Medicine. And last but not least, we have another very esteemed guest joining us today. I'm very happy to have Dr. Vinny Tanasia joining us. How you doing, Vinny?
I'm doing good, Prescott, and thank you everybody for having me here.
All right. Now, I just want to let everyone know that Dr. Tanasia is the Public Health Director for Tarrant County Public Health. He has more than 13 years of experience in healthcare and public health as a physician and as an epidemiologist. Dean Flynn and I are going to be asking our guests some questions about COVID-19 vaccination plans and also how we are keeping TCU's campus safe this year. If you want to be a part of this discussion, all you need to do is jump into the comments, leave your question for our guests, and then we will definitely get you some answers. But before we get to that, I'm going to begin with Dr. Tanasia. Dr. Tanasia, can you just give us a quick update on the COVID-19 vaccination in Tarrant County right now?
Sure. So as some of you may know, that we have had two successful vaccine candidates that have been given the emergency use authorization by the FDA. So that's a vaccine by Pfizer and another vaccine by Moderna. They're both similar technology. They're messenger RNA vaccines. And we've had a vaccine available since mid-December, even though the supply is very, very limited. And public health has been getting our vaccine in allocation since about just a day or two before Christmas. But even despite these limited number of doses, the county as a whole has already given out over 100,000 vaccine doses. That's about 5% of our community has already received at least one dose, and almost 10,000 people have completed their series already. And as you know, there was some prioritization that healthcare workers, first responders should receive it first. So obviously they're completing their series first. But there's a lot of effort underway in our community, and we're doing a pretty good job very fast. Tarrant County is currently leading the state in getting the vaccine out, and our state of Texas is leading the country in getting the vaccine out. So two things to be very, very proud of.
And Dr. Tanasia, I just want to ask you, those numbers are actually fantastic, and that's good news for Tarrant County. That's good news for North Texas. Can you just talk to us a little bit about Tarrant County's plan to reach people in the areas that they're most affected once we get past the frontline healthcare workers and people over 65 with pre-existing conditions? What is the plan to help get some of those people who most need the vaccination vaccinated?
Mm-hmm. So it's a kind of a multi-pronged approach, but to keep things simple, we are looking at the recommendation from National Academy of Medicine, even the White House National Strategy referenced that that we should all consider the CDC's Social Vulnerability Index. And that is a sort of a measure of all the social determinants that may impact someone's health and ability to seek opportunity, right? I mean, we can give people equal opportunity, say, here's vaccine, come get it. But there are folks in our community that are just stuck in their life cycle and can't reach up to that opportunity. So the SVI, or the Social Vulnerability Index, takes 16 determinants and grades the neighborhoods and the zip codes and gets down to the census tract level on where there are vulnerabilities in our community. And that's one of the ways we're considering, and hopefully next week or so, we plan to sort of start implementing some of those things. In the meanwhile, as interim steps, we did get some guidance from DSHS and did already prioritize those category 1A and 1B. So those are healthcare workers, first responders, and in 1B, seniors over 65 and people with underlying conditions. So that was sort of the first step. The second step was last week, we added hardest hit zip codes where there's current outbreak at the highest levels. But those kind of leave their own, they have their benefits, but they have their own challenges. It does leave a little bit of that equity gap unaddressed. So moving to the SVI model is going to help us start addressing those equity gaps.
All right. I just want to let everyone know this is FWMD Live. And today we're talking about Tarrant County's COVID-19 vaccination plans. And we're also talking to TCU's Chancellor Victor J. Boschini and also Professor Akaraju from TCU about keeping the campus safe this year. If you have any questions, all you need to do is jump into the comments, leave your question, and then we will definitely get you some answers. Dean Flynn, I want to bring you into this conversation. When we spoke in December, when we talked about our medical students getting vaccinations, they already had questions and how long would it take? Can you talk to us about any progress that has been made for getting the medical students vaccinated, since they are working with clinicians in the field already?
Yeah, thank you, Vinny. You're absolutely right. They asked very quickly. And I should just frame it around the fact that we have two classes of students. They're all seeing patients. So they had a very vested interest in inquiring about being vaccinated. At this point, around 40% of our students have been vaccinated, and that's been with tremendous appreciation, with TCU being a part of that, Tarrant County Health Department, Vinny's department, and JPS. So that's been a major step forward for our students. We're also partnering with Baylor Scott and White and hoping to set up a vaccination hub also on the TCU campus, and those plans are still being forged ahead. Chancellor Boschini, maybe I can segue into asking you a little bit about the campus. TCU students returned to class on January 19th. Can you share with us how this is being planned, has been planned as a safe return to campus, the importance of the Protect the Purple campaign that the university has put forward to reduce the spread of COVID-19?
Sure, thank you, Dr. Flynn. Yes, we basically just repeated our plan that we had for fall and that we thought was very successful. It involves a lot of enhanced cleaning and social distancing in the classrooms, and rethinking everything about how we interact with other people. We also expanded our free testing for students and faculty and staff for that matter. And we even were lucky enough to have a group, and I think this was due to Dr. Taneda, work with us on campus to have a testing site on our campus. And so you can just walk, it's right across from the Union, which is where most kids hang out. And so we're doing all that. But I just really want to thank, we have an incredible team of students, faculty, and staff who have worked on this. And it's been incredible, led by Dr. Cavens-Tull, our COVID-19 response group. And they've just an amazing job of keeping people updated and keeping people as safe as possible.
Thank you. We've heard Vinny talk about the availability of the vaccine and its distribution. Can you share an update of where TCU is and the plan to distribute the vaccine to employees and students?
Sure. Our plan is to give anyone in our campus community, students, faculty, or staff, the vaccine for free. And we've been really blessed that we already got our first 100 doses. And we already have 121 people, I think it is, because there was some extra in the dosage. I didn't realize, I'm not a medical person, so I don't really know how this works. I just play one on TV, but it's, they got extra. And so we actually have 121 people who now have received their first and second doses, and we're just waiting for the next round. But our plan is to give anyone who wants it on campus the vaccine for free.
Great, thank you.
All right, and that's great information, Chancellor Boschini. I just want to reintroduce our conversation. This is FWMD Live. Today we have TCU's Chancellor Victor J. Boschini. We have Professor Akaraju from TCU talking about campus safety during COVID-19 pandemic. And we also have Dr. Vinny Taneja from Tarrant County Public Health with us talking about the COVID-19 vaccination plan and how to get that distributed to residents in Tarrant County. If you have any questions, jump in the chat, leave your comment, and then we will get some answers for you from our guests. Vinny, we had one question came in for you. So Dr. Taneja, the question is, with the new White House announced plans of vaccine allocation, what is the projected timeline to move past just the 1A, 1B group and get more to the general public?
Good question. Currently, no change in plans. It is expected somewhere in March, and a lot depends on actual vaccine supply. And just to kind of clarify, the federal plan is a little different than what the state is actually doing. So under the federal plan, the 1A was obviously healthcare workers, first responders, and several of those groups. There was a federal 1B, which was critical infrastructure, so government workers and defense sector, education, and variety of other, there were 16 other sectors. And then federal 1C was seniors over 65 and people with underlying health conditions. Texas decided to skip the federal 1B of all the critical infrastructure and go right to the seniors and people with underlying conditions with good thought that that's where we were seeing most of our cases and a lot of deaths occurring. But it has created a little bit of a capacity gap. With the federal plan, there was a sort of a ramp up time for people to have the mass vaccination locations up, have enough vaccine supply coming in to be able to, meet the demand. So demand is here, but the supply has not. So from a supply standpoint, it's still projected that it will improve by March to meet all the needs and then move on to the next phases.
All right, that's great information. And we have another question for Chancellor Boschini. And this question is from Wendy. Wendy, thank you for your question. The question for you, Chancellor Boschini, is, do you have an estimate of when TCU might start vaccinating students that have signed up and are already interested in getting the vaccine?
Unfortunately, no, we don't have a definite time because we're at the mercy of receiving the vaccines. We expected to have our second round of the first round, gets confusing, of the vaccines by now, but we haven't gotten them. But I'm told the first week of February, and maybe Dr. Taneja will know more, that we're supposed to get another round. But as soon as we get them, they're going to be in people's arms as fast as we can do it.
All right, that's great information. Now, Professor Akaraju, I want to bring you into this conversation because you study viruses a lot. And so what we have been hearing in the media is that there are new strains of the COVID-19 virus appearing in different countries in the UK. Some are from South African. When you think about the vaccines that have already been developed, do they provide some protection when these new strains start to develop from a virus?
So viruses like coronaviruses are capable of changing their shape quite easily, kind of like the flu virus. And so every time a new strain appears, you actually have to go back and test the vaccines and the antibodies they produce against that particular virus. So they have tested the new strain from the UK against this vaccine, and it seems to work. The new strain from South Africa, the vaccine seems to work, but not as well. So they may have to adjust the dose for that because the antibodies generated in the body don't seem to be as effective. There's yet another new strain that just showed up in Brazil, in the city of Manaus, which seems to be extremely infectious. And they'll have to test the vaccine against that as well. So unfortunately, every time a new strain comes up, we're going to have to check to see if the vaccine provides enough protection by generating antibodies in the body to block the virus from entering our cells.
Okay, that's great information. Dr. Tanasia, I want you to just go back and talk about something that Chancellor Boschini mentioned earlier about the partnership with TCU and helping colleges in the area get vaccines so they can try to get their essential workers vaccinated as well. Can you just talk to us a little bit about what that process is like working with schools in the county to make sure they're safe as well?
Yeah, so there's a concept called open points of dispensing. Those are for public. And there's another one called closed points of dispensing or closed pods. And that is for institutions, whether it's a university, whether it's a large business. So when vaccine supply becomes abundant, where we can get it to everyone, those closed pods concept will become very, very important. That's where a closed pod for TCU campus folks, staff, faculty, students would become very important. That way they don't have to go stand in line at a public location with thousands of other people. There's ample supply for everybody. You can do a closed pod. Till then, when prioritization is still in play and all those other things are, and the limited supply is in play, it's only people that are qualified either under 1A, like we talked about, medical students and doctors and nurses and so forth, or those under 1B. So that could be faculty or students, right? I mean, somebody could have an underlying health condition and they're 18 years old. That's fine. And those folks would be either getting the vaccine at TCU if y'all get the supply, which I know has been very limited, or they can, of course, register with the county's website at tarrantcounty.com/COVID shot, and we will invite them in. They're just going to be in queue with like everybody else. So it's when it's limited, it's a little harder. But as the supply improves, I think a lot of those plans can go into play. We've all worked on those plans for years. We've practiced handing out Skittles as a practice run, so we know how to do this. It's the logistics, right? The vaccine administration is not the hard part. It's getting the logistics right is the main issue. So we can do this. It's just we need the vaccine supply to be here.
So Vinny, I'd be remiss if I didn't thank you and your team and your department for all you're doing. So on behalf of everybody, thank you, first of all. Tremendous effort. I can't even imagine what you all are going through. Can you share a little bit? We're hearing and reading about possibly not preserving enough vaccine for one second dose and using it all to get everybody the first dose. Can you weigh the pros and the cons to that a little bit for us?
Yes, that's a very interesting strategy. I think we heard first from the UK that they were trying to get vaccine into as many arms as possible, especially because they were worried about the new UK strain and they thought they were kind of running out of time to fight against COVID. They had just come out of a lockdown and vaccine distribution started, so they had done everything the way it should be. And then their luck was kind of running against them. It's an interesting strategy. Our FDA has yet not given anybody the green light to do that. The current recommendation is still complete the 2-dose series, but it has value. 2-dose series gives you a 95% efficacy rate for both vaccines. With a single dose, the data is a little unclear, but we're kind of thinking around 70+%, which is great. I mean, flu vaccine is most of the time 50% efficacy rate. So we'll take any vaccine that gives us 70+%. Again, we are bound by what the FDA emergency use authorization allows, but getting vaccine into more arms certainly is a strategy that we welcome. I think the evidence is building. Even in our community, you're seeing a tapering off of this high peak that we had seen in like almost from October till early January. We were just through the roof on cases. And mid-December, vaccine distribution started to sort of ramped up in last week of December, early January. And right around January 8th, cases just dramatically started declining. All the indicators dramatically started declining. Nothing has really changed. Yeah, the holidays went by, so people probably got done with their shopping and visits and all that. That helped, but the vaccine also helped. And that was just one dose. So there's some evidence building that there is some value in doing that, but we will let the FDA evaluate all of that and get us clear guidance on whether that's doable or not.
Vinny, can you just help a little bit in lay person's terms, or at least maybe terms that Dean can understand? When we talk about 95% efficacy, can you translate that, what that actually means?
Yeah, it's a hard concept to explain. So to simplify, I'm gonna tell you something that's not entirely the way it works, but generally, if you give it to 100 people, 95% have the full immune response, and the rest of the 5% are out of luck. So that's an oversimplification. You know, they actually build these studies, and then kind of it gets a little complicated. But general rule of thumb is that 95% of the people who complete their series are going to be protected, and the other 5% may not be.
Do you envision then maybe antibody titers being drawn down the road, like in hepatitis, to see who actually didn't get an immune response?
It is possible, and there's every strategy has its value and has its flaws. We do know that antibody response sort of subsides after a while, and there are other cells in the body that remember, you know, the memory T cells and many other cells that can remember that we have seen this vaccine before. So the antibody response may fade, so it's not a perfect tool. But if you are exposed to the virus, your body will remember and respond to it. So we'll see. You know, we've used it in other vaccines to check for immunity and so forth. But currently, the white CDC card that's issued, if you've completed your series, that will be your sort of your proof of vaccination. And especially if you're traveling overseas, I'm sure airlines and countries are going to ask, hey, have you been vaccinated for COVID-19? And that CDC card is a gold standard. It's been there for ages. I mean, several decades. So we should carry that once you complete your series, and that would be your proof.
Thank you. Prescott, I apologize. I'm not handing you back the microphone. Jerry, can I ask you also one question? You talked about the mutations and of different viruses, strains. Can you comment looking forward? Are you able to predict, or maybe a different way to ask it is, why do viruses do this? What is their advantage?
So viruses have a genetic sequence that carries information to help them make more viruses. And when it gets inside your body and inside your cells, it starts making copies of the genetic sequence, which then makes copies of viruses. And with viruses like coronavirus, which have a genome made of RNA, as it's copying its genetic sequence, it makes a lot of mistakes. And these mistakes basically create variations in the proteins that the virus makes. And so oftentimes when you make mistakes while copying your genetic sequence, they're called mutations. They're bad for you. But the virus replicates at such a high rate, like millions of particles in each person, that even if 1% of these mistaken genomes happen to get through, it could offer an advantage to the virus. So flu is the same. It's a virus whose genetic sequence is made of RNA. So every time it copies, you generate variations. And these variations could then offer the virus an advantage and help it avoid the immune response, for example.
Perfect. Thank you.
Very, very interesting. Great information, Dr. Akkaraju. Just want to let everybody know this is FWMD Live. Today, we are talking about COVID-19 vaccinations in Tarrant County, and also a safe return to campus at Texas Christian University. If you have any questions, just jump into the comments, leave your question, and then we will definitely get you some answers from our guests. Chancellor Boschini, I just want to get your thoughts on, as the year progresses and more people receive the COVID-19 vaccination, when do you think people will feel more comfortable, and at least the university will feel more comfortable doing things in a group setting as we traditionally have done education?
Boy, that's the $1 million question. And I'm hoping that answer is sooner than later. But I think that so much depends on the rate of vaccination. But I really think from most of the people that I've talked to on campus, once people are vaccinated at a higher level, I think people will feel more comfortable resuming normalcy. I'm certainly hoping by March or April, and then by summer, I'm really hoping. But mainly because I need this hope to go on, because all of us, I think, are really fatigued by all of this.
All right. Thank you for that, Chancellor Boschini. And we all have a lot of hope. And Vinny, I just want to give you one more opportunity. A similar question. As we move forward throughout the year and more people get vaccinated, how long do you think we will have to continue wearing masks and practicing social distance just in general around the county?
That is a very important question. And folks, this is not the time to let your guard down. Even though the vaccine's here, we are still very new about learning about the virus and learning about how the vaccine is going to be effective. We know that it prevents, illness in 95% of the people who complete their series. Generally, that means that they will probably not spread the virus either, but that is not a proven fact yet. We have to have some time to see that happen. And you really have to build immunity in your community, right? So you got to get above that 70% mark, which is generally a rule of thumb for herd immunity. Higher is better. And so that's going to take a while, right? We've only done 100,000 people. We're a county of 2.1 million people. So you got to get somewhere reasonable, 1.5 million or above before we let our other measures that are public health measures helping us go away. So in real estimations, probably by the fall, we will maybe find a way to relieve ourselves of all of these things. But till then, wear your mask, even if you've been vaccinated. Stay 6 feet away from others. Avoid large, crowded events. Only things that are necessary, like work or school, we understand that. Even then, try to do things online as you may be allowed. And then really wash your hands throughout the day. Dirty hands do spread diseases, including COVID. So, all those things combine. And when it's your time to get the vaccine, don't miss it. Go get the vaccine, because all of these things together are going to get us out of this pandemic. And we really need to push COVID down to a level where it's not a threat like it was as a pandemic. And then we'll deal with it like the flu. And I can put another hope out there. With a vaccine that's effective, 95% efficacy, if we all do these things, automatically diseases like COVID are on the elimination list. Because usually when vaccines are this effective, it may take us 2, 3, 4 years to get the entire world to get to a level of vaccination, but it can be eliminated. The more we let it spread, you're probably going to find a mutation that makes it sustainable and stays around, or finds another host like a pet dog or something. So let's not try to let it spread too much, and get vaccinated and do all these things, and we'll be out of it soon.
All right. Great information. Thank you so much, Dr. Tanasia. I want to thank everybody on Facebook for being a part of today's FWMD live chat, and a special thanks to our guests, Dean Stuart Flynn, Chancellor Boschini, Professor Akaraju, and Dr. Tanasia. Thank you all for joining us today. This is FWMD Live. We'll be back February 17th at 11 a.m. Thank you all for watching today's show, and we'll see you soon.